We're gonna have something to measure in there.
Okay, so you're gonna place your patient in supine position. Always bring your tray close to you because you don't want to have the tray. And also always kind of like at the level of your waist. There's a bottom here. Right phone, you're gonna push it down. Because you don't want to have these too high that you're always like having to stand up and sit down, or too far that you have to sit too much. Alright, and bring your computer closer so I can start documenting. Alright. Okay, so for my intraoral exam, I have my patient supine position, I have the safety glasses, I'm in full PPE, I already changed my clothes, I wash my hands. So what is the first thing that I'm gonna start observing?
You are going to observe lesions, rolls.
The lips, right? So I'm gonna observe for the
Oh, that's
vermilion border.
extraoral. My bad.
The vermilion border is gonna be the border of the mouth, the border of the lips. And it's important to look for continuity. Sometimes patients have lesions like from the sun exposure. They may have lesions here. Sometimes they have cracks around this area, and we have to notate whether the patient, if the patient has dry lips, we have to document that. So in this case, what do you think? Is there well moisturized or a little bit dry?
A little dry.
A little dry, okay. So I'm gonna put the intraoral exam. I'm gonna put dry lips. Okay. Then I want to ask my patient to open a little bit, please. And then you can observe the labial commissures. These corners here are the labial commissures. Here and here. Sometimes my patient may have cracks on those areas. Sometimes they may have like a fungal infection on those areas. So it's important to look at those areas and document if there's any crack, any lesions, any aphthous ulcer in those areas. We have to document. So in this case, when she's opening a little bit, do you see anything?
No.
No. Something also very common is called Fordyce granules. I don't think she has any. The Fordyce granules are like little dots that are kind of like fluorescent, like yellow fluorescent. Those are just fat deposits. That's normal. So if you see them, you have to notate them and put the location. So some patients may have Fordyce granules on the vermilion border. Some may have just Fordyce granules on the labial commissures. Some may have on the lips and also inside, like on the buccal mucosa, like inside the cheek. Sometimes they're like, Miss, I don't know what that is. And those were Fordyce granules. Okay. All right, so I'm observing this. So now I need to palpate the lips, right? And how do I palpate the lips? With how many fingers? 2 fingers. And that is called?
By something.
By, what is that? Where are my fingers?
By
When I'm typing something or on the phone?
By
Digits?
By digits.
By digits, okay. I've been trying to find it. So I'm gonna palpate that because they may have patient may have a nodule. And as I'm palpating, I'm also observing for the vestibule, the gingiva. So this is my attached gingiva. I have here my free gingiva. And do you see how the color kind of like changes from coral pink?
Mm-hmm.
And you see right here kind of like the capillaries.
Mm-hmm.
So that is the alveolar mucosa. And the vestibule is gonna be deep right here, kind of like that U shape between the lip and the alveolar mucosa. So right here, that's my vestibule.
Okay.
Some patients may have lesions there, especially if they're wearing like a complete prosthesis, like a complete denture. Sometimes if the patient is brushing their teeth and they hit a spot right there on the vestibule, they may end up with an aphthous ulcer. So as I'm also observing that area, I'm gonna look for the frenum. Some patients, like in her case, she doesn't have anything, but some patients may have like a little skin tag. If they do have, you have to notate it. The skin tag on the maxillary frenum. We're gonna observe on the mandibular frenum, right there. And then, oh, what does she have here?
A lesion.
A lesion. Yes, very good. All right. So this lesion It looks like a. What does it look like? What do you think happened there?
Look like she bit her leg.
Bitter.
Yes,
Mhm,
and
it's
it's
healing.
red, right? And it looks like a little tiny clot. So these, the way we call these is petechia. So petechia, I think you have it there. It's like a little clot that is trapped on the tissue.
There's one on the other side too. It's worse.
Okay. So we're gonna put here petechia. And where is the location? Where can you put a first location?
Left. Lower. Inside.
We can put it on the mucosa, on the
Buccal.
left
Buccal mucosa.
mucosa,
The left mucosa.
or buccal mucosa,
Buccal,
yeah.
okay.
Left buccal mucosa, close to where?
Oh wait, we did. We just said it.
Yes,
The
The
vestibule.
labial corners.
labial commissure.
Corners. Okay.
Okay, very good. Very good. And then when we observe the buccal mucosa, she has it perfect here too. Turn a little bit to the left. Do you see? Open a little bit more. This line here. Right there. That's the linea alba, and that is right there on your paper. And then I'm gonna see if she has it on the other side. So turn a little bit towards me. A little bit more towards me. And she has it right here. And Tom, what else she has here?
A clot.
Which is, what's the name of it? We just learned it. Petechia. Right? And right here, that's a linea alba. Can you see it right there?
Yep.
That line? Sure.
Mm-hmm.
So if she has it on both sides, we can put bilateral. So we're gonna put bilateral linea alba.
So that's the line on both sides from biting.
Uh-huh.
Now I'm feeling it.
Everybody's like, and she also has the petechia. So what will be the location of that petechia? Turn a little bit towards me.
Right.
Right?
mucosa.
Buccal mucosa,
Buccal
very good.
mucosa.
And it's kind of like close to, maybe close to number 2. Okay. So something else that I have to do is I have to palpate that buccal mucosa right here. I'm gonna put my hand here because I want to feel also for any nodules, anything. I come back here. I'm gonna use the same finger because I don't want to put this and then the saliva I'm putting it outside. So I'm gonna come this way. Okay, very good. So I observe the buccal mucosa. Now what else can I see behind the motors? What is the name of the tissues that are beside the motors? Maxillary tuberosity.
Oh.
So the maxillary tuberosity, move your chin up a little bit.
Number 7.
Right
Okay.
here.
There we go.
This area is my maxillary tuberosity. So she has a wisdom tooth right there. This right here is my maxillary tuberosity. And I'm gonna serve it on the other side as well. Turn a little bit towards me. Right here. If the patient doesn't have a tooth here, they may have like a little wider maxillary tuberosity, but in this case it's just this part right here. That's my maxillary tuberosity. And then on the mandibular teeth, this is not gonna be called maxillary tuberosity, this is gonna be called retromolar pad. One here, and I mean, you have the wisdom teeth distracted. So, yeah, okay. So you can see a little bit of the tissue, like a little depression here because the wisdom teeth was there. But right here, that's my retromolar pad. Okay. Well, she's a perfect patient. Okay. We have the incisal papilla right here. that is between 8 and 9.
Mhm.
And then what is the name of this? Right here, this line.
So, wait.
It's on the palette.
Taurus.
You have Taurus, but there's the line, the Palatine.
Palatine taunt? Or wait. I don't know. I'm trying to find it.
In part of all-
Forgot my.
Your
That's right.
papilla is 10C, medium
10C.
Palatine graphy.
Median Palatine Raphy?
Mhm.
What does that mean?
That is that line that is covering the Palatine suture. So if you remove this tissue, and if you see the skull on the palate, there's a suture in the middle. So when the tissue covers that, that line is covering the suture. That
So
when
it's
the two
elevated.
palatal processes get
When it
together.
comes together, okay.
So it's a Palatine graphy, and then if you see on the same 10C, the rugae, Palatine rugae is these kind of like elevations here.
Oh, like the ridges?
Mm-hmm.
Okay.
Yeah. Okay, here and here. Okay. And then she has a beautiful, what is this? The name of that?
Taurus?
Yes.
Oh, yeah.
It's either palatal torus or torus palatinus or maxillary torus. Do you see right there?
Oh, she does.
Mm-hmm.
Mm-hmm.
So when you're feeling for that torus, if you just go straight open, please, like this, you may be like, oh, this is just the palate. Move your finger always right to left. So then that way you can feel the shape of that torus. Okay? All right, so I have my torus. I can see my hard palate, soft palate. So my soft palate kind of like ends. Do you see the difference in colors? Like right here is changing to another color. Right here.
Mm-hmm.
So right level kind of like right here, that's where my hard palate ends, and then all this is my soft palate. If I have my patient, if I put the tongue to the breast and I wanna ask her to say ah, very good. So right there is the uvula, the anteriors and posteriors pillars.
Oh, just making sure they're not swollen.
Right. We want to make sure that they have tonsils. Some patients may not have tonsils, and some may have the tonsils, but there's redness.
Mhm.
And then we ask, oh, have you been having a sore throat lately? Oh, yes.
Mhm.
Then on the buccal mucosa, we're gonna also look for, what is the name of that duct for the parotid gland?
Duct. Oh, the
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 stencil.
orthones.
So
Or-
on the buccal
organs?
mucosa is gonna be the stencil.
The stanson? Where am I from?
Oh, number 6.
Yes.
Oh, we're going back.
Stenson
Oh, and there's
stuff.
the petechiae.
Oh, the stanson
Yeah,
duct.
the petechiae. Mm-hmm. So right here, do you see that buccal mucosa? And do you see a little right there?
Mm-hmm.
That is gonna be the stencil duct. So you're just gonna kind of like milk it this way and this way, and your Q-tip should end up being a little bit wet.
Mm-hmm.
So that's to check the salivation, and then come this way because they may have an obstruction right here and this way. Okay, so that's gonna be my stencil duct. And I just noticed that she has very little. I think she has a little bit of Fordyce granules, but let me see. Open a little more. Just very tiny right here.
On
Do
the
you see
lip?
those little dots right here?
Oh, yeah.
Those are the Fordyce granules. Some have like, they're more obvious. Like hers are
Mhm.
very.
What is that? You said that was that the
That's like
Fat
little
deposit?
fat deposits.
fat
Mhm.
deposit? Okay.
All right. Any questions so far?
No?
No? Okay. We're gonna observe, palpate, and see the tongue. So you're gonna open your 2x2. So you're gonna open your 2x2 this way. You're gonna fold it. And you're gonna place it here and ask your patient to stick the tongue out. Take it out. You're going to fold it. Grab it from here. So that way you can observe the lateral borders. This way and also this way. Remember yesterday we were talking about the papillas on the tongue?
Mm-hmm.
The big ones, also in the dorsum, right here, those are the fungiform. Do you see those? Here, 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 here. That's the fungi ones. And the tiny ones that are all over the tongue, those are gonna be the filiform. On this side, on the back, is gonna be the foliate, like lines. And then the circumvallate, I don't know if you can see those. Stick your tongue out. You can see just a little bit. Do you see right there? Right there?
Mm-hmm.
Those are the circumvallate. Okay. In her case, do you think she has like white coated tongue? Like, do you think it looks white or you think it looks more like pink?
Stick it out. Pink.
White. What do you think?
I've seen a white
I
tongue.
think it's
That's
more
pink.
towards pink.
Yeah, it's pink. I've seen a white tongue. Call them hairy tongues.
And then you want to palpate it too. Sometimes they may have a scar. In her case, she doesn't have like fissures. Some you feel like cracks, like wrinkles.
Mm-hmm.
Hers is slightly. Do you see the borders? How are a little bit like this?
Mm-hmm.
It's slightly scalloped. Put the tongue inside. Open. Take it out a little bit, just a little bit. You see the borders? This is slightly scalloped.
Question, the only time you write something down when you're checking the intraoral is if you see deviation, correct?
Any deviation from normal, yes.
From normal.
However, freckles, for example, those are normals, you still have to document.
Like how you check the everything in there, you don't have to write, okay, the ducts, they're normal.
No, they're normal.
But
if they
only
will
when
be-
you see a deviation from
Yes.
the
So
normal.
if there's no saliva coming out, then you're probably gonna put obstruction on, bilateral obstruction of Stenson's duct.
Okay, so only put something there.
The side scallop tongue, and then we're gonna put the Fordyce granules.
You can have those granules on your gum tissue too, right?
Yes.
Okay.
And that's what you witnessed on the inside of it.
Mhm. Okay, so now I observe the dorsum of the tongue, but I have to observe also the ventral surface of the tongue, right? So I'm gonna ask my patient to place the tip of the tongue up. Very good. She has the lingual frenum here. Some patients may have a short lingual frenum, so then when you're asking them to place the tip of the tongue up, they may go just up to halfway, like this. They can.
That's me.
Okay. And then she has the veins here. I wouldn't call this necessarily varicosities, but a little bit here maybe. But usually in older patients, you're gonna see this vein kind of like inflamed, like a cord. So then you're gonna call this varicosities. She has just a little bit here on the right one, but I think the left one is fine. So we can put varicosities.
What does that mean?
It's just the, how we have sometimes the veins inflame on the legs.
Oh.
So it's like
varicose
a
vein.
varicose on the right. Okay. What else? There's the tip of the tongue up again, please.
You have to make this alive.
And now I'm gonna check the floor of the mouth. Relax your tongue. So I'm gonna place one hand here and I'm gonna feel for the floor of the mouth. And as I am palpating the floor of the mouth, I'm also checking the border here where the bone is and what do I see here? And I can feel it too.
Tor.
Yes. Do you see those bumps here? Right here? There's one. We're going to move your chin down a little bit. One is here and one here.
Would that be bilateral torn?
Bilateral. Mm-hmm.
Okay.
Some may have a small one, and hers are probably gonna be seen on the X-ray as well.
And if it's just one, you write where it's located,
Mm-hmm.
Tori,
If it's just one, it's gonna be torus.
Taurus.
And then we have to also put the palatal torus. And then, what else? Have that's something that is also on the floor of the mouth. Place the tip of your tongue up. The caruncles, the whartons, for the whartons,
That's
that's
the
on the
wharton.
sublingual,
Okay.
is right here. One
So
here,
shoots out at you.
and then one here. Okay, those are gonna be the caruncles. And again, you just milk them, and if it's wet, then she has good salivation. The gingiva, right here, as you observe, I have my attached gingiva. I'm gonna have my free gingiva when I probe. That part is gonna be my free gingiva. My interdental papilla. You can look for the color of the gingiva. In this case, what is the color of the gingiva? Pink. It is also firm. Like it's not bulbous, it's not inflamed. Once I see the change in color right here, this part from here to here is my attached gingiva. This is my alveolar mucosa. All this vascular area is my alveolar mucosa. The depth of this between the inside of the lip and the alveolar mucosa, that is going to be my vestibule. Okay. When patients have recession, this papilla is going down and you can see the embrasure, which is going to be the space. So the color is like a pink color, consistency is going to be firm. The shape, it's kind of like, they call it knife-like. There's a little bit of a stipple, like if you see these little dots right here, those are called stipples. So on a healthy gingiva, you're gonna see those stipples. When the patient has like a lot of inflammation, it's all shiny, but those stipples are gone. If there's redness around the free gingiva, then that's the first signs of inflammation is the redness and the bleeding. Okay. Am I missing anything? Occlusion. So I'm gonna move down to occlusion. For occlusion, I'm gonna look at the molars. Maxillary molar with mandibular molar, the first maxillary molar with the first mandibular molar. I'm gonna look at the, turn a little bit away from me, please. Insert in spoon light, bite down. Do you see the first molar right there? Okay. Do you see the mesiobuccal cusp? Here is my mesiobuccal cusp right here, and this is my groove, the groove of the mandibular. Open a little bit. You see right here one cusp, mesiobuccal, distal buccal, and distal. This is my first molar, my three cusps right there. Bite down again. Is the cusp sitting on the groove?
Yes.
Yes. So if it's sitting on the groove, that's going to be occlusion class 1. If my patient doesn't have the molars, then I have to look at the canines. Premolars here, canine here, canine here. For a class 1, the canine have to be, the mesial cusp ridge have to be sitting on the distal cusp ridge. And hers is kind of like sitting on that area. But in her case, because she has the molar, I'm gonna look at the molar to help me with occlusion. So she's gonna be class 1, but I have to look also on the other side because sometimes patient will be class 1 on one side and then class 2 on the other side. Right down. Okay, so what do you think right there the buccal cusp is sitting on the groove or not? No, right? Is the molar, the mandibular molar, a little bit more towards the back or the front? The mandibular one.
Front.
Is it moving towards the back?
Mandibular looks like the front. No?
Yes.
Right?
Back.
Back.
Okay.
Right. So if it's moving towards the back, it's gonna be class 2.
Oh, I can't. I'm looking at the wrong one.
You can be behind me. Right.
Okay. Yep. I
And you
see
can
it
kind
now.
of confirm it with the canines.
Yes,
Kind of like
because that's
even
where I
one
was
with
looking
each
at the
other.
canine. Mhm.
So in class 1, this one is a little bit forward, so if you cannot see on the same level, that will be class 2. So I'm gonna put for occlusion, class 1, 1 on the right side, and 2 on the left side.
Okay.
Okay. Keep bite down. I don't see any crossbite, as you can see. Oh. Bite down. Look
Yeah,
at those molars.
you have to call it way out.
Is the buccal cast sitting on the fossa? Do you see the second molars?
Mm-hmm.
Are they occluding like the cusp on the fossa?
You can pull
Or are
it
they
further.
this way?
Wedge.
Pull my chick out further.
Wedge.
Bite down.
Nice.
Right there. Open a little bit. Look at the first molar, how it's occluding, and look at the second molar.
Mm-hmm.
Bite down.
What's going on with my molars?
So instead of being looking from the side, this is the buccal. This is the buccal. Instead of being like this, maxillary mandibular, in her case, she is like kind of like this.
It's like flaring out, like that
This
way.
one like this. Like this.
Like this is coming this way. Yeah, like this way.
Yes. And then she's not the cusp is not sitting. This cusp here on the buccal is not sitting on the fossa. It's this way. So she has a little bit of crossbite on that area. Okay, so bite down again. There you go.
So class
You see how is the cusps
one
on the
with
mandibular are not
crossbite?
sitting? Mm-hmm.
So class 1 with a cross.
So it will be crossbite on tooth number 15 with 18. So we're gonna put here.
But the right side would be class 1, and then the left side would be class 1 as well, or class 2?
Class
Right
2
side
is
was
So the
crossbite.
left side is still class 2 from the occlusion is
Yes.
class 2. But we are not also noticing that she has crossbite.
Crossbite.
The right side,
Okay,
we're gonna
so
leave
this
it
side
still
is
as
class
class
two.
1, and we're gonna see if she has any crossbite on that side.
Okay.
Right down. And here is fine. If you can see, the cusps are sitting on the fossa, the same on the second molar. Okay. Right down. Very good. So now we're gonna check for overjet. Think of JetBlue. The planes are horizontal, right? Well, usually they are gonna
Over would
traveling
be, okay, that
horizontally.
makes sense.
So that is gonna be your overjet, is gonna be the horizontal measurement. So I'm gonna come here with the tip of my probe. I'm gonna put it on the facial surface of the mandibular, right there, or here. I'm gonna try to look at from kind of like 12 or 11 o'clock. How much do you think, what do you think is the reading here?
4? 'Cause, well, 3. It's just hitting that black
3
line,
would be
so-
right here.
Yeah, so that would be 4, because it's not on the other side, so it's not 5.
So for overjet, it says here millimeters, I'm gonna type 4.
4, okay. See, doing the stuff in the office with the dentist, you don't know why they're doing it.
Yeah, they
You
just call out
just-
the numbers and you're like,
Yeah.
yeah, writing it down.
Yeah, now I know why and
And then-
how.
Yeah. And then for overbite, it will be how much she's covering with the maxillary, how much on the mandibular. So if you see, open a little bit. Okay, so you have to see kind of the length of the mandibular incisors. So when she's closing, you're gonna see whether she's covering just the incisal third or the middle third of the tooth, or more than that. So
Mm.
close. How much is she covering? Half.
Middle.
So that will be moderate overbite. If it's just incisal third, will be a slight. If it's on the middle third, will be moderate. And if it's more than that, will be severe. You
Okay.
can barely see those. You can probably see just the cervical third of the mandibular incisors. And then midline, I'm gonna sit at 12 o'clock. I'm gonna look like an imaginary line that is passing through the tip of the nose between 8 and 9 and 24 and 25. Open a little bit, bite down. Do you think it's even? Move your chin up a little bit, bite down again. Or do you think it's a little bit deviated? Try to come here at 12 o'clock.
Okay.
Ask her to open and close. Do Do you think everything is even?
No.
Okay, do you want to? Perfect model, she said.
Okay, I
Do you
guess
think
a
everything
little.
is even a little off?
My
Yeah.
my lower anteriors or the front of the top too?
The lower.
Okay. Yeah.
So in this case, we're just gonna put either off or deviated. So off or deviated, one is good. Okay, we don't have to worry about whether it's deviated to the right, left, whether it's the mandibular or the maxillary. If we don't see anything, everything aligned, it's gonna be deviated or off. If everything is aligned, we're gonna call it even or centered.
Okay.
Okay. And then missing teeth. So the missing teeth, I can complete it when I'm doing my hard tissue. And I have my panel, of course. Okay. So let's say that she's missing the wisdom teeth. You know, she said I have all my wisdom teeth distracted, so I'm going to...
I only have one left.
You only have one left?
Yeah, 16 I think is left.
16. Okay. So
The one that
this is how I'm
messed
gonna
up the
find
rest
it.
of them.
So she still has 16. So I'm gonna click on 1, 32, 17. I have some icons here like extraction, amalgam, restoration, or I can find them here too. Restorative, endodontics, perio, oral surgery. Okay, so in this case, I'm gonna click here for extraction. I click there, and then existing other, sorry. We have existing other or existing or treatment. Existing other is, that means this procedure has been done out of Concord in another place. Okay, existing, that means it has been done here.
Okay, so everything is existing other.
Very much. And then treatment plan is when the dentist comes and does the exam, he may say, okay, we can put sealants on 19. You will select on treatment and it will show red. So right now these are existing others, so we're gonna click on existing other and then boom, gone. Let's say she has, let's see. Okay, she has a composite right here, number 3. It looks like an occlusal lingual. So I'm gonna look for other composites, but right now I'm like, okay, I'm looking for composites. I'm gonna go little by little. I'm gonna have my air dry everywhere. I have to. That's another OL 14 and also 15. So I can click on 3, 14, 15. I can click here for resin composites or restorative. I have amalgam, resin. Even if it's one surface, that's okay, because once we select the teeth and the surfaces, they're gonna change the code for posterior. If I'm selecting something from the list, I'm gonna click on the check mark, and then EO. And because I selected multiple, they're gonna show here the tooth number. So this is for 3. So if it's occlusal lingual, it's just gonna go with OL. Now for 14, let's say it was DO. I wanna click on is occlusal. And let's say for 15 is just occlusal. Okay? And then we'll document everything for me. Okay? I think I cover everything. Dorsal, Wharton's, fibula. Okay. Any questions?